Hi, I'm Dr. Janet Pope from London, Ontario, and I'm a Room Now reporter. And my handle is at Janet Burdope if you want to follow me and learn more about this hashtag ACR21 meeting. So I am vexed about VEXAS and I tweeted about it, but I thought I'd talk about it because it's starting to sink in. So it's actually a really neat story. So VEXAS is vacuoles that were found in the bone marrow of certain cells. E is E1 enzyme. X is X-linked, so more common in men. A, autoinflammatory, and it's a somatic syndrome. So VEXAS. So basically, it was just recently diagnosed, and it's an autoinflammatory adult onset disease as opposed to the child onset. And so, what do I mean by that? They get fevers, cytopenias, vacuoles in myeloid and erythroid precursor cells, and they can have a dysplastic bone marrow. They can be accompanied by all sorts of things. So neutrophilic cutaneous lesions, so that's sweet syndrome, pulmonary infiltrates, relapsing polychondritis. So there was some interesting discussion. So in the episode 6S410, they had down and dirty 30, VEXAS, a new genetic disorder. And what they told me and what I learned was that relapsing polychondritis occurred in almost 6 out of 10, sweet syndrome, 1 out of 3, maybe 1 in 4, depending on the groups you're looking at. Myelodysplastic was 1 in 5 to 1 in 3 of the patients. MUGOS, monoclonal gammopathy of uncertain significance, again, 20% of patients. PAN-like pattern, which is different from sweet syndrome, about 6 to 12%. And a giant cell arteritis type pattern was about 4 to 6%. So lots of different things going on. They also discussed hearing loss, periorbital edema, the polychondritis that I talked about, nose and ears in particular, increased venous occlusions, the fevers, and various skin involvement. So this is a very broad syndrome. And what they talked about in this meeting was really that it seemed to be responsive to glucocorticoids. Pretty much most people didn't need to go beyond that treatment, but if they did, tocilizumab, one of the JAK inhibitors that's used in polycythemia, there's some data on, and some other agents that would be more bone marrow specific. And they had mentioned a word of caution on avoiding IL-1 inhibitors such as anakinra or Kineret because of severe skin reactions. Now, we're used to skin reactions in RA with that drug. It's daily sub-Q. It's also used in some autoinflammatory syndromes of children and also systemic onset JIA. So we're used to skin manifestations of hives and welts and things like that, but I guess it's worse in VEXAS syndrome. The other thing I'm going to just shout out, there's abstracts coming. So 1104 is looking at VEXAS in a Japanese patient population with relapsing polychondritis. So looking at that UBA1 variant gene. There was also looking at transfusion dependence. So that's the aplasia and predicting mortality. And that's abstract 1426. And then there's a case series in abstract 1457. So what's the take home? I'm vexed by VEXAS, but I'm learning more about it. And as I reflect on my practice, I think I actually have 2 patients with relapsing polychondritis, adult onset autoinflammatory condition that I treated with glucocorticoids, and then I just made up treatments such as methotrexate or MMF, and both of them eventually did well, but they were difficult to treat. And as I follow, I have to keep in mind all these bone marrow issues that they might have. So follow us at Room Now and enjoy ACR 2021. Thank you.